During the COVID-19 pandemic, we've really seen public health take a more spotlight role in the community. Oftentimes, the things that we're doing are behind the scenes, so people don't really see it or realize all that we are doing. When in reality, during a time where there isn't COVID-19 or there isn't a pandemic, we're just as busy doing other public health duties and serving the community behind the scenes. Imagine a world where there are no vaccinations for diseases and there isn't anyone there to inspect the food you eat, or a world where our drinking water is dirty and we have a lower life expectancy and higher death rates. Public health, we're always working to prevent the spread of disease in one way or another, but during this time, we've really gotten the media attention as most or all of our public health efforts has been geared toward COVID-19. From designing and coordinating testing sites, building systems and databases for COVID-19 data collection, ensuring healthcare workers have adequate personal protective equipment, to even meeting the social needs such as transportation, food, and housing for individuals who may be affected during this time. Public health, we've been tasked with these responsibilities because we do have the community connections and the infrastructure to carry out these essential services, and we've executed these plans efficiently to meet the needs of our population, even though funding has been inadequate in public health and we've really had to stretch our staff and our resources.
It went from coming out to do your food restaurant inspections, your WIC appointments, your hands visits, that we come out and visit with you and your newborn baby, to now focusing our efforts on the COVID-19 pandemic.
The COVID-19 pandemic has certainly heightened the level of visibility and value of our organization, as we've responded by providing continuous and various forms of media communication to create awareness and educate the public, expanding our epidemiologic response capacity by repurposing staff, refocusing our environmental enforcement efforts, as well as implementing a drive-through testing site to provide more access to testing.
We have provided weekly Facebook Live updates for our community. We've provided testing via our mobile public health unit. We have worked very extensively with our Amish and Mennonite populations, which Todd County has the largest Amish and Mennonite population in the state of Kentucky per capita. And we have also partnered with our long-term care facility and local doctor's offices to provide personal protective equipment through our regional hospital preparedness coalition, as well as training to the staff of our long-term care facility.
We've been responsible for enforcement of business compliance with COVID-19 restrictions. We've monitored PPE, we've handled the strategic national stockpile pushes, we've monitored bed capacity of hospitals, we've had to do interviews, we've been consultants with schools, hospitals, long-term care facilities, businesses and the general public in regards to reopening after the economic shutdown. We've been tasked with keeping the local elected officials informed about what's going on, plus a whole lot more other things.
We've also worked very diligently with contact tracing. As we've gotten positive cases in, we've contacted those individuals, let them know they're positive, and instruct them on how to self-isolate and what else they needed to do. Mitigation of the disease has been a large role for our health department. We have a special population, the Hispanic population, where our numbers have consistently been going up. So working on identifying what the barriers are for this special population, as well as how we can mitigate the spread of the disease, has been a big part of our role.
Many times it can be so frustrating because so much of what we do is behind the scenes. And because it goes unnoticed, our funding often gets cut because people just don't really understand who we are in the community and what our role is. Because of funding cuts over the last several years, public health has really had to make some sacrifices, and we've been left with depleted resources in some areas.
Funding, obviously, we have gotten some funding for the work that we've done, but there's still a lot of unfunded COVID activities, and public health is strapped for resources anyway.
We've seen public health over the last decade, the funding cut more than in half, and we have a whole lot fewer resources than we had a few years ago, and those would have sure come in handy at this.
Some of the things that would have made our job easier is if we had had more funding for public health staff, and to have more staff to help assist in contact tracing. If we had electronic systems that could help us track and monitor, and the technology to be able to do that more efficiently.
Our response in this pandemic certainly would have been more effective with dedicated federal and state funding to support foundational service capacity to ensure a minimum level of epidemiologic, environmental, preparedness, and communication professionals in our jurisdiction.
And it isn't just during the COVID-19 pandemic that we need the additional staff. I mean, we need to have the money to be able to recruit and retain staff to carry out essential public health duties during our everyday activities. There's just so many things that public health needs. While other agencies and facilities they closed down during the pandemic, public health, we've been open and not only continuing to serve the community, but we've taken a lead role with new responsibilities and we've been operating at increased capacity. But these things, they take time, they take resources, they take money.
And we need you to provide a dedicated focus to prevention for our health's sake.
We are Kentucky Public Health.
We are public health.
We are Kentucky Public Health.
We are Kentucky Public Health.
We're looking to you, our state and national leaders and our representatives, to stand up for us as public health and make sure that we have the resources that we need to continue to serve our community.